Good evening, residents. Welcome back to another fine evening for psychiatry resident live module de-addiction psychiatry. So we are towards the end of de-addiction. After reading de-addiction for you, I realized that de-addiction is technically basic considerations. That was the first lecture. Neurobiology, that was the second lecture. A few major topics. The major I have given sufficient time to tackle. Please remember, if you get an exam question, you are more likely to get a question on tobacco, alcohol, the most important, exam case, cannabis and opium. This we have covered over the last 4 classes we had. And today I am here with the minor topics. In the minor topics we have stimulants, we have caffeine, we have hallucinogens, we have inhalants, we have sedative hypnotics, and last but not the least we have gambling disorder. When I was going through this chapter from the book, I saw that in the minor topic there is a very limited information in the book. I was reading guidelines of MOHFW, I was reading guidelines of your IPS, a little bit of Maudsley. Actually Maudsley is not that good in de-addiction because the protocols they follow in UK are not the same protocol that we follow here in India. So Maudsley is not that good for substance use for us, although it's a very excellent book, but not as good as for us. So are you able to hear me properly? Vatsal, Suchak, Sundaramurthy, Vinitra, good evening. No, anyone else here? Only 3 of you today in the live class. I'm seeing off late, more number of students were present in the live classes of adult psychiatry as compared to de-addiction. Maybe because de-addiction is not as exciting, as interesting as adult psychiatry was. The number of students were a little more in adult psychiatry because probably the adult psychiatry module started before the third year had exams, and this module had started after the third year had exams. So I guess the students attending the classes now are second year and first year residents. But good that you are attending, and I hope you are getting something out of de-addiction psychiatry. So today this is the topic list. The minor topics. What I'm planning is some students have requested a note on internet addiction. So I will try to cover internet addiction in the last class, just 21st September. I will try to cover internet addiction in the last class. But I would like to tell you, internet addiction and gambling disorders are both in behavioral addictions. These are both behavioral addiction. Rupali Shinde, good evening. Ankita, good evening. I am happy to see you, the students, in the live class, because once you keep on interacting, I feel you are here. Otherwise, I feel bored while teaching, as if I am teaching myself. Santarul Haq, good evening. Thank you for replying. Kamal Bajaj. So this is actually the layout of the entire structure. So when I went through the textbook, I found a limited information on these topics. So hence I clubbed all these topics for today. So this is an orientation to what we have taught, what we have covered. We have covered basic consideration, we have covered biology, we have covered TACO. And this is the topic for the day. So shall I start? Are we all set? Are we all set? Ready? Okay, so the topic of the day, number one, stimulant related disorders. None of these is a long question. All these are 10 mark question, 5 mark question, short questions, not a very big question. So we will read limited information about it. What are stimulants? Stimulants are the drug that act on CNS. Why do we call them as stimulants? Because they increase the brain activity. Because they increase the brain activity. Good evening, Harshini. Good evening, Rachit Sikchi. And they produce excitement, euphoria, increase in focused attention, and increase in alertness. This is the definition of stimulant. They act on CNS, increase the brain activity, they produce excitement, euphoria, increase in focused attention, and increase in alertness. I hope you are writing. I hope you are making notes. Stimulants may be natural stimulants derived from plants or synthetic, that is produced outside. Nowadays, a new concept in stimulant is coming up, is amphetamine type substances. This is the, suppose somebody asks you what is a new stimulant. Amphetamine type substances, these are the newer stimulants. It has been recently released in the IPS latest newer substance of use guidelines. IPS released a newer substance of use, and my colleague was asked a question in his viva, classes of stimulants. This classes of stimulant is not given in the textbook. It was references Ministry of Health and Family Welfare guidelines. There are three classes of stimulant: class 1, class 2 and class 3. Class 1 has a very high abuse potential. Class 2 also has a very high abuse potential. And class 3 has a low abuse potential. Class 1 can't be prescribed. It is 100% banned. Class 2 include prescription as well as non-prescription drugs. Class 3 are weaker stimulants. In class 1 is included MDMA or ecstasy. In class 3 is included cocaine, methylphenidate, which is the drug of choice for. Methylphenidate is the drug of choice for those who have attended my child psychiatry module. I have taught you methylphenidate, prescribing, how to prescribe, when to give, whom to give. Amphetamine. Modafinil or modafinil. Actually, modafinil is too much blamed for dependence, but it does not have that much abuse potential as it is proclaimed to be. We, speak a lot about modafinil dependence because students have started taking modafinil for staying awake during exam. So we discourage the use of modafinil. I am not sure whether somebody among you has used modafinil for your exams or not. You asked me, I have seen one patient who has taken MDMA, about 5 to 6 patients of amphetamine. I was not sure whether it was MDMA or amphetamine, couple of patients of cocaine, but I have seen a big number of patients who have been using modafinil and methylphenidate. So can you tell me, when we sit in private practice, which stimulant dependence we are more likely to encounter? Which stimulant dependence we are more likely to encounter? It's modafinil. Modafinil. I know a boy who has been taking modafinil approximately